This portion of the news is brought to you by Inspiration Senior Living, where we provide affordable elegance to Pahrump area seniors. Give us a call at 751-2300 and make an appointment to tour our community.
Agitation and aggression are common in patients with Alzheimer's dementia and are a source of stress and distress for caregivers. Patients may shout, curse, or even become violent. Currently available medications have lots of side effects and are only modestly effective for treating agitation. A new study tested a combination of two existing medications and whether this would help control agitation in patients with Alzheimer's.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
Lori Gabello is very familiar with hospitals and doctors' offices. Her father has Alzheimer's disease and her mother dementia, but it wasn't always that way.
They were extremely active. They traveled a lot. They were extremely social.
Now, in full-time care, both of Lori's parents have frequent bouts of agitation.
When people do come in to help him with his showers or his daily care and stuff, he does get extremely agitated. She gets very upset and very agitated, no matter what it is. What they're serving for dinner, the fact that they play the same music over and over.
These are the things that make caregiving so extremely difficult when there is a violent or aggressive reaction by the patient.
Dr. Jeffrey Cummings from the Cleveland Clinic and co-authors recruited 220 patients with Alzheimer's dementia and agitation. During a preliminary 10-week trial, participants were randomly assigned to receive either the combination of dextromethorphan and quinidine or a placebo.
The dextromethorphan-quinidine combination had a substantial effect in reducing agitation, and it did so at a substantially greater rate than was experienced in the placebo group, and we showed that the drug was safe and effective.
Dr. Cummings says there also appeared to be benefit for the caregivers of these patients.
There was a reduction in the stress experienced for caregivers of the patients who were treated with the dextromethorphan-quinidine combination.
Although caring for her parents is sometimes overwhelming, Lori takes comfort in knowing they have lived full lives.
They didn't not do anything that they set their heart out to do that was on their bucket list. They did all of it.
Catherine Dolf, The JAMA Report.
Thanks so much, Catherine. The combination of these two medications is not yet available for patients. More studies are needed before the results can be presented to the FDA for approval. More than 1.5 million bicycles with front disc brakes and quick release levers are being recalled because they could cause crashes. The recall involves 13 manufacturers and distributors and covers 17 brands. An issue with the bike's front wheel hub could cause the front wheel to come to a sudden stop or separate from the bike, causing the rider to crash. There have been 3 incidents reported, including one that broke the finger of the bike rider. Bicycle stores nationwide sold the bikes from 1998 through this year. Consumers can get free installation of the new quick release. All the bikes affected cost between $200 and $10,000 and were created by Diamondback, Rally, Breezer, Fuji, SE, Cannondale, GT, Felt, Jamis, Giant, Haro, Norco, Access, CVS Cycles, Navara, Ridley, and Specialized. The companies involved have set up a site with more information on the recall at quickreleaserecall.com. There's a special training session for those who would like to help children in the foster care system this weekend.
I recruit for all 15 counties outside of Clark and Washoe, and every single one of those counties is in desperate need for foster homes, especially the more rural our communities are, the more in need for foster homes there in order to keep kids that get taken into custody in their communities as opposed to having to put them in a different community because there wasn't a foster home.
And that is something that is can be traumatic for the children to be taken out of their home, first of all, and be transferred somewhere else where they're not in familiar surroundings, right?
Oh, not only is it traumatic for them for what they've already been through, but then to come into foster care is traumatic. I mean, can you imagine having to be moved from the community that you know and love, your friends, your teachers, your family, and then having to be placed potentially 100 miles away, or if not more, into a different home of total strangers already. I mean, it's very traumatic for these kids to have to go through that process. So we need homes in every community so that these kids can stay in their communities and thrive, do well, and be reunified with their families.
So you're looking for people who would like to provide a community service, help out these children, a loving home, somebody who is really looking for something that they can do to give to these children. How do people qualify? How do they get involved?
Well, they would need to call me at 888-423-2659. That comes directly to my desk. I can answer all the questions that they may have, tell them about the licensing process. I'm the one that kind of walks them through that process until the actual home study is completed. So I can give them a lot of information about, what's required, because I think there's a lot of misinformation out there about what we require of people to be licensed. So
can anybody be a foster parent?
Of course, anybody can be a foster parent. You do have to be 21 years old, though. But there is no age cap. I have people that talk to me all the time and say, I'm too old to foster. And I kind of laugh because we have foster families that are, well into their 80s. So as long as you are physically capable of caring for the age range of child that you want to be licensed for, then you are perfectly capable of being an excellent foster parent.
Minister Jesse Osborne spoke to News 46 recently about his church.
It's called First Second Church of Pahrump, Nevada.
Where's it located?
It's located on Homestead and Game Bird.
All right, and you have regular church services, but you also have an evangelistic program. Tell me about that.
Yes, we have our ongoing evangelism program, which consists of 8 classes that one needs to attend to graduate and be certified on the National Baptist Association out of Memphis, Tennessee, under their Christian Education Department.
You have some graduates. It's going to be happening soon, right?
Yes, October the 25th. We're going to graduate our first evangelism class, which we are very excited about it. And we are inviting as many churches as we possibly can to come out and celebrate with us this great event of our students graduating from evangelism at Second Baptist Church.
How many graduates?
We're going to have about 15 graduates.
Wow. So everybody can take these classes, right?
The classes are open to the community.
What's the graduation going to be like?
The graduation is going to consist of a message from our senior pastor out of Second Baptist Church in Las Vegas. And then there will be other events taken around that. And then the graduates will march and receive their certificates, which we are very excited about.
So can you tell me about the regular church services?
The church services, Sunday school starts at 10. Our regular worship service starts at about roughly 11:15. We also have on Tuesday evenings, we have worship and praise, which consists of testimonies, we consist of Bible study, and after which we go into our evangelism classes.
And what day is the evangelism graduation taking place and time?
Sunday, October 25th at the Artesian Clubhouse at 6601 Fox Street here in the city of Pahrump.
Wonderful. What time?
3 p.m.
Wonderful. So everybody can come on down to the Artesia Clubhouse there on Fox Lane and find out all about the evangelism graduates, about the class, about your church.
Right.
Also, they can stop on by for any of the services?
Yes, they can. We welcome visitors.
And once again, what's the address and phone number?
The address and phone number I'll give you. I'll read them off to you so that I can get them correctly for you. The phone number for the church is 775-537-1587, and we are located at 1651 Homestead Road.
When News 46 returns, we're going to tell you about an upcoming plant sale.